X-arch taping is used to support the arch of the foot. You will start by placing one strip below the toes. This strip will be known as the anchor strip. From here is where you will start the rest of your strips from. Your strip is going to start at your pinky toe, go across the foot, behind the heel, and up to your big toe. Once this strip is complete, you are going to do the same thing but in the opposite direction. So you're going to go from the big toe, down, below the heel, and back up to the pinky toe. We're then going to complete this process for the rest of the toes. So you're going to use the toe next to the pinky toe, which is known as the fourth, go across, under the heel, and up to the toe next to the big toe, which is known as the second. Once you have done this, you will bring a strip back the other way. So from the second, back to the fourth. Your last strip is going to start at your middle toe, also known as your third. You're going to go laterally from your third to your third, and then you're going to go back the opposite direction. Once you have completed this last strip to the toes, you are going to do similar to the anchor. You're going to cover everything we have just created. You're going to cover it to the heel of the foot. The ankle wrap with a horseshoe pad is going to start with an ace bandage just below the toes. You're going to wrap this once around just to make sure that there's enough tension. You are then going to take the horseshoe, place it on the outside of your ankle with the bone of your ankle in the middle of the horseshoe. You are then going to take the rest of the ace bandage and wrap it around the foot in an X pattern. You're going to continue this pattern up the foot, making sure that you're tight at the bottom and looser at the top. Once you have completed this pattern all the way up the foot and you are out of ace bandage, you're either going to take the clip that comes with the bandage and connect it to itself, or you can use white tape and close the bandage off that way so it stays tight. Ankle taping with a closed basket weave and heel locks. First, you're going to take the adhesive spray and spray it on your patient's foot. This allows for the heel pads as well as the pre-wrap to stick more easily. A heel pad is going to be placed at the top of your foot as well as at your heel. Once you have attached the heel pads, you can grab pre-wrap. Starting at the foot, you're going to wrap it around, covering as much of the surface as possible of your foot, ankle, and lower leg. Once you have finished with your pre-wrap, you're going to take the white tape and make an anchor strip. An anchor strip is a loop of white tape that you are going to attach your other tape to later. You have one anchor strip at the foot and two on the lower leg where your pre-wrap ends. Once you have completed your anchor strips, you're going to take the same white tape, use the medial side, which is your big toe side of your foot, attach this tape to the anchor strip, go down over your ankle bone, under your heel, and up the opposite side. This is known as a stirrup. You will complete 3 of these in total, but before you complete the next stirrups, you're going to make a horseshoe. You're going to start on the foot with your anchor strip, go back behind your heel, and up the other side. In total, you're going to repeat this process 3 times. So you're going to start at the top of your foot, go down over your ankle bone, under your heel, and up the opposite side. Again, you're going to make a horseshoe. So starting on your big toe side, you're going to stick it to the anchor on the bottom on your foot, go behind your heel, and up the opposite side. Once you have completed this process 3 times, you're going to close. So you're going to take the white tape, go back over your original anchor strips at the top and the bottom of your foot. While closing, you can also go all the way around the exposed pre-wrap. Once you have closed, you're going to start something known as a heel lock. So you're going to take the white tape, stick it to the pinky side of your lower leg, go across the leg, below the heel, behind the heel, and then back up in front of your ankle. You are then going to repeat this process in the opposite direction. So on your big toe side, you're going to start at the lower leg, go down, under the foot, behind the heel, and back up. This process will take place 3 times on each side. Once you have completed the heel locks, you are able to close. So you're going to start at the top of the ankle, and similar to the anchor strips, you're going to wrap the tape around and back onto itself. Every time you close, you're going to create single strips. So you're going to rip them every time you make one loop around. The ankle taping subpatellar sling is done in combination with the ankle tape that has just taken place. You are going to start by placing the thick tape just below the big toe. You're going to angle the tape so that it covers your bone of your outside ankle. You're going to go under the heel and then up and back towards where you completed the anchors of the last taping. At the top, you can use scissors to cut the tape. You are then going to use the same tape, come back to the bottom of the foot, place it so that it's on the pinky side facing the ankle bone on the opposite side of what you just taped. You're going to go over the ankle bone, under the heel, and across the taping that you had just completed. Once you have done so, you're going to take the white tape and close, exactly how you closed the ankle taping. You're going to start on the foot, and then you're going to go to the ankle and close up there as well. For the Achilles taping technique, you're going to use adhesive spray and spray the back side of your patient's leg and foot. You are then going to take the white tape and create anchor strips. These are going to be about the middle calf of your patient. Once you have completed both anchor strips, you're going to put down the white tape and grab a different type of tape called Power Flex. This tape allows for more flexibility in the foot. With this tape, you're going to place it in the middle of your foot where we put the anchor strip for the ankle tape as well. Because of its flexibility, you can wrap it around a couple times to make sure that the patient is covered in this area. Once you have created the anchor for the foot, you're going to take heel pads, place them on the back side of the patient's leg. Because of the adhesive you sprayed earlier, they should be able to stick a little bit. You are then going to grab another type of tape. This type is going to be brown in color and far less flexible. This tape is going to get stuck to your anchor on your foot. You're going to pull it up over the heel and onto the anchor strips on your lower leg. Once you cut the tape across, you're going to then cut it so that you can make two sections. Once you have cut this tape, you're going to pull it apart about 3 or 4 inches down. You're then going to pull the foot so it is tight and place the strips on opposite sides of the leg from each other. Once you have stuck this to the anchor strips at the top of your ankle, you are then going to complete this again. You're going to take the brown tape, stick it to the anchor strip at your foot, pull it up over the heel, cut it, then cut it longitudinally, and then again use the strips to go in opposite directions around the calf. While you are doing this, it's important to make sure that the patient's foot is more plantar flexed, which means you are going to have it so that you are seeing their bottom of their foot at an angle towards you. Now that you have completed 2 strips, you're going to take a third, place it at the foot over the heel, pull tightly, and instead of cutting it in half, you're just going to place it on the original anchor strips. Once you have done this, you're going to take the white tape and, similar to an anchor strip, you're going to complete the circles around the calf again. You can complete 2 to make sure that the brown tape is secured to the calf. Once you have done this at the calf, you are then going to move to the foot. And you're going to complete the same thing, however you're going to use the Power Flex that you used originally at the foot. The donut pad used in this case is a small piece of felt that we have cut a hole in to allow the bony structure to poke through. In this case, you're going to place it over the bony structure and then use coverall, which is a sticky adhesive piece of bandage almost. You're going to place this over the donut to secure it to the area, and you're going to leave it like this. It's important to make sure that the coverall is smoothed out and stuck to the hand in order to keep the donut pad on through activity. The thumb spica is used to make sure that your thumb does not AB duck too far. You're going to take Power Flex, which we use to wrap the foot in the Achilles taping, wrap it around the wrist, then move and wrap it around the thumb, back down to the wrist, 1 loop around the wrist, and then back up to the thumb. Once you have used the Power Flex on your wrist, you can cut it and stick it to itself. You're then going to grab the 1/2 inch brown tape. You're going to start the brown tape on the palm side of your hand. You are then going to wrap it down, under the opposite side of your wrist, up, over the base of your thumb, around your thumb where you're going to make sure that it's pulled into tension, across your first string that went across your thumb, and then down. You're going to end on the same side of the wrist that you started on. You're going to complete this process 3 times. The tape is going to overlap itself, and that's okay. Once you have completed the 3, you can go back, grab the white tape, and create another anchor strip. You're going to make sure that this strip goes over where you started with the brown tape, just to make sure that it's secure and will stay if the participant is acting in any sort of sports.